Let's go ahead and go back to scan utilities.
All right.
And let's choose any two scans again. And let's look at L, and then on the 21st, D. And now you're going to see a dramatic change.
Wow, okay. Yeah, the entire full spine area is nicely centered.
Yeah.
And well within at least, I would say, what, 0.8, 0.7 degrees maximum.
Well, we'll go ahead and we'll actually take a look at the bar graph in a second.
Okay.
But as you can see, everything's quite on center and very, very good. Everything is normalizing beautifully. So we're 17 days into treatment. The scans are resolved, and the patient's actually been out of pain, both in his low back and in his lower extremity now for about a week.
Mm-hmm.
Feeling very well. Now let's go to the bottom over there again at that we're about 4 centimeter mark on the left AT.
Yep, the yellow shows where you were concerned.
Yep. And now it's resolved.
The red now is much warmer and resolved.
And the hockey stick sign is gone. And if we go ahead and hit B for bar graph, you can go ahead and take a look at both scans, and you'll see that everything is quite normal.
Right. Right. Very nice.
Now, let's just be a little careful here and say, now, is this a typical thing? We're going to take all our patients with disc protrusions, and in a couple of weeks they're going to be perfect. Well, no. But in this case, the patient did quite well with care. But I want to say that full spine scans, when we're working with patients, the scans usually take a bit longer than this. We shouldn't be overzealous. Depending on the patient, it can take weeks to months to get the nervous system back online. Of course, it depends on the chronicity of the case. It depends on what is going on for things that factors in their lifestyle that bring things back. How you're adjusting the patient, how often you're adjusting the patient, the technique that's used. There's all kinds of things that are involved. I couldn't even think about taking care of patients on a daily basis without it. The minute we started using this type of technology in our practice, the type of patients we were seeing, the difficulty in cases, the real chiropractic stuff really came out. I mean, I was very disillusioned at one time because I was seeing mostly musculoskeletal patients and not very difficult cases at that. But when we started using this technology, having patients come in and say, yeah, I wanted to come see you because I have the flu. The type of stuff that we want to help patients with in general, their whole health, started to come out. Managing patients when you're looking at their neurophysiology is completely different and very, very rewarding. But this is the tool that's needed.
Right. A lot of times we are asked, where can I get some more information? It's been a long time since the schools have taught this kind of work in depth. Tell us a little bit about how we can get on your website. And also, I understand that there is a new international organization called IACT.
Well, basically, the International Academy of Clinical Thermology, or IACT, has been around since the 1980s and is the largest multidisciplinary group of physicians worldwide that are providing thermography services. The new IACT, the reason we're calling it the new IACT, is the new officers, the new structuring, and the new ways in which the IACT is functioning. And this is, of course, one of the new ways, is that this multidisciplinary group of physicians recognizes this instrument and paraspinal thermography on its own. This is very big news. This is very revolutionary and very important to our profession as chiropractors, because, of course, some people do have a tendency to poo-poo this technology because they don't know about it. They don't know how valuable it is. Basically, all your spinal nerves are exiting the spine at this point, and you're getting a quick snapshot of how things are functioning as the autonomic nervous system moves out to govern internal function of the body. And everyone knows that's involved in this field how important this is, and right there at the spine, that's very, very important information. And so with this recognition has come a course for board certification in paraspinal thermography. So for the first time, DCs, MDs, doesn't matter. If you're coming, you can be certified and board certified as a paraspinal thermographer, giving you a very good course. It's a 36-hour formal classroom training course, basically 3 weekends. And then, of course, there's time on top of that. The best way to look at the prerequisites is to go to www.iact-org.org and go into the professional members section, and you'll be able to pick out paraspinal thermography and look at the prerequisites and the information there, the course outline on what we go over. And basically this gives the field doctor the information on how scans are performed, the protocols for the laboratory or basically office conditions, how to perform scans, how to interpret them, not only for subluxation or shall we say abnormal neuropathophysiology analysis, but also for things like fractures, herniated discs, things of that nature. And also with board certification now, when insurance companies or independent evaluations are done on cases, you basically can say to people, well, who's reading my scans, who's interpreting this, because they don't have the qualifications. So this is a real super time. And at this point, the only instrument that is recognized is the C3000, because it is manufactured to the stringent guidelines, of course, as you well know, Roger, for thermographic analysis.
Mm-hmm. All right. Well, I really appreciate the time that you've spent with us.
You're most welcome. Glad to be of service.
And we will share this with doctors who have written in or called in asking for more information.
Great. Well, if I can say one thing, if they do become interested and use this technology on their patients, their eyes will be open to a whole new world. It's really exciting. And this is a very exciting time in chiropractic, because now this technology is available. It wasn't before. So this is wonderful, and I thank you for producing this for us.
And the schools are now introducing the students to
Yes.
the use
Yes.
of the scanner. We're at Life East, Life West, Palmer East, Palmer West. We're at Northwestern. We're at Sherman College. We're at Parker. So a good number of students are being reintroduced back into what chiropractic was all about.
It's exciting.
And it is a really neat time. We do get more and more calls of doctors who are sharing with us how they're starting to really reach their organic problem patients.
Yes.
And that's what this is all about. That's why we did this. So again, thank you, and we will do this again.
Great.